All right, so I'm a recreation therapist. I work in patient psych mostly. When we started doing the program, I worked in the psychosocial rehab and recovery program. And we used to do CTC with that program. And even when I moved into inpatient psych, we still kept our outpatient group. But mostly my job is in working in patient psych.
I'm a recreation therapy assistant, started a few years ago, work on our short-term nursing facility, and then also on inpatient psych. And then Wendy has let me take Buddy, her service dog, around and do some groups. And after that, started talking to me about this program with CTC and got involved doing this. And I think it's been almost 2 years, if we include the quarantine, that I've been doing this. Yeah, and it can be a mix too, because you can have people who are, they just had a stroke and they're like committed. They're like, I'm gonna get back, I'm gonna take care of myself, I'm gonna go back to, living in my own home independently. And then you have other people who, like, that was the last straw and they've completely given up. They don't wanna get up, they don't wanna talk to you, they don't wanna get out of bed, they don't even wanna try to move, the side that isn't working or engage in any activities, because they're like, well, this is just it for me. So it's interesting because you have people come in and they all have the same or similar conditions, and they're on completely opposite ends of the spectrum for where they are in their life and what they see can be their future.
With CTC, because we do that as an outpatient, those veterans have to be motivated to come in on their own. It's a much more structured program where each week leads to the next week. What you learned last week, you're going to use this week. It's a lot more, maybe even productive than what they get when they get the facility dog.
And that's what's, I think, one of the things that's nice about our program is it is longer, and you've got that 10 weeks, because like you said, on your floor, it's 1 week to 3 weeks. My floor, people are only there usually 2 to 3 weeks. Occasionally we'll get people there up to 6 weeks. But you've got 10 weeks and this person's committed to it. So you really get to see something happen and you get to see a change take place. You don't get that in a week or two, usually not anything significant.
These are skills that not only are applicable to a human-dog relationship, but also to a human-human relationship. So I think the benefits are that they not only get to have fun and hang out with dogs, but they are also learning communication skills, social skills, task skills, things that everybody needs to learn to do in life, and all can carry over from the dog-human relationship to the human-human relationships.
People, I know I see it a lot on psych, like people, they've been living on the street, so they've built this shell, and there's not a lot of ways you can come out of that are safe or acceptable to, other people in the room or other people on the street. But it's okay to bend down and rub the dog and show them affection, and not have the other people in the room be like,
it's not manly. You're not a man. You love a dog, because everybody loves a dog.
Right.
It's the one thing that's almost to 99% socially acceptable is loving dogs. Mm-hmm. So it's okay to let your guard down and love on a dog.
Yeah.
No matter how manly you are. And I think that, no matter how everybody's day starts on, Canine Therapy Day, everybody's day ends positively. Whether it's myself as a therapist or the veterans or the volunteers, or even sometimes the dogs are like, nope, I'm not feeling it today. I feel like by the end of that hour and a half, every single time, everybody seems like they feel better. Everybody seems like they've been touched by the experience.